Hi, everybody. Welcome to this episode of Care Anywhere. You may know that for 50 years, CGF&S has supported the career mobility of foreign educated nurses and other health professionals looking to take their portable careers to another country. In fact, that's why we were founded. The American Nurses Association and the National League for Nursing established CGF&S to be a verification gateway for international nurses who were seeking entry to practice into the United States. We've expanded that mission over time to include programs and services for career mobility for that workforce and for other countries needing the same expertise. But unless you've ever had to move your career to another country, you may not know how challenging it can be, the regulatory requirements and the logistical obstacles that need to be navigated. It's a long process that for many can take many years. You'll meet two nurses in this episode who have taken that journey themselves and now work in the international recruitment space because they're passionate about helping foreign educated health workers pursue opportunity and thrive in a new country. I'm talking to Sinead Carbery, President of International Staffing Solutions for AMN Healthcare, and Gillian Williams, Senior Director for Clinical Operations, also from AMN. So let's jump into it. Across global health systems, health workers on the front lines of care delivery are carrying more on their shoulders today than ever before. Workforce shortages are increasing. Scope of practice is shifting, and skill sets are definitely evolving. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Together, we're diving deep on the challenges and opportunities that loom large for recruiting, training, and equipping the health worker of the future. Welcome to Care Anywhere, the Global Health Workforce Podcast, brought to you by CGF&S International. Welcome back, everybody, to Care Anywhere. Excited for today's episode. I want to welcome our guests today, Gillian Williams and Sinead Carbery. Guys, thank you for joining the podcast. It's great to have you.
Great to be here, Lea.
So I'd love for you both to introduce yourselves. Told everybody a little bit about you at the front end, but we would love to hear more about where you work and what you do, where you sit in industry. So Sinead, if we could start with you, and then Gillian will kick that over to you. Just let everybody know a little bit about yourself would be great.
Sure, Lea. So it's great to be here today. I'm Sinead Carbery, and I'm President of International Staffing Solutions for AMN Healthcare. Been doing this for quite a long time, almost 30 years. Originally came to the United States as an O'Grady patent nurse, so I'll tell you a little bit more about that as we talk today, but excited to be here.
Great. Gillian, welcome.
Thank you, Lea. So I'm Gillian Williams. I'm one of the Senior Directors for Clinical Operations here at AMN Healthcare. And I've been a nurse for, seems like a million years now. Came to the US in 2005 and, went through the same journey as our international nurses today. But in my role, I'm responsible for our clinical teams, supporting our international division and other US clients.
So you're frontline with all of these international health workers. That's great. We're going to dive into that today for sure. I want to start with, really the crux of our conversation and certainly what ties to the work here at CGF&S, which is helping health workers with their career mobility and making decisions to take their portable skills from one area of the world to the other, or one region of the world to the other. Sometimes it's not necessarily across oceans, but it might mean picking up and moving. You both have that in common, not only nursing as a clinical background, but you both have a migration story that I would love for you to share with our audience. You chose this for different reasons. You probably had different challenges, but our audience, which encompasses everyone from regulators to, ministries of health to health workers, I think would benefit from understanding what that journey looks like, the challenges, the drivers. So we're going to jump in there. And so, Gillian, I'm going to kick that to you first, and we'll kind of bounce back and forth. So, Sinead, if you can share after Gillian, that would be great. So tell us your story. Where did that begin for you?
Oh my goodness. So my story began in Trinidad, which is a tiny island off the coast of South America. And, back then, this was around 2004. When you're a nurse in Trinidad, it's a small place. So there was not much career mobility, right? We literally had to wait for someone to retire, or God forbid, pass away, for there to be any career advancement opportunity. And so I'm the type, I never like to sit still. There is too much to be done in this world. So I started researching, getting to the US and practicing in the US. I actually completed my NCLEX exam on my own. I purchased one study book, read it through cover to cover, and I passed the NCLEX exam. So I actually had reached out to a company called Nurse Finders back then.
Yeah.
Nurse Finders actually became an AMN company later on, but that fell through. Then one day, I think in early 2004 maybe, I heard about this company called O'Grady Payton that was coming to Trinidad to recruit nurses. Mind you, I was 5 months pregnant at the time, but I thought, hey, I'll go and see and hear what they have to say. So myself and two other nurse friends, we took the day off and we went. And it sounded so interesting, really everything I was looking for. So I went home, spoke to my husband, and he said, why not? And that started my journey. And I ended up coming to the US to my assignment in 2005. So it was a rather short process at that time.
It isn't a short process for everyone, which I'm sure we'll talk about later. So where did you end up here? What work were you doing in the US when you got here with a health system?
Yeah, so I was placed at a facility in Tucson in Arizona, fairly near to the Mexican border. So, one of the things that really I really am grateful to OGP was their flexibility with me. My first job offer was actually at a facility in Vermont, or it was in the Northeast. And of course, if you're familiar with the Northeastern US, the winters can be cold.
It's not Trinidad.
It's not Trinidad. So I started to think, oh my goodness, I'll have a newborn baby. My son would have been around 5 at the time. And I started to think about going there with just very young children.
Yeah.
So I approached my OGP representative and asked to be, if they can please try to find me somewhere else. And they did. They found me another opportunity over in Arizona, which is as hot, as
Yes.
Trinidad, or maybe a little bit hotter. But I was so happy for that placement. And I took up my job at Corona St. Mary's in Tucson. Yes.
Amazing. So opportunity was the driver for you, pursuing opportunity that was limited where you were. Sinead, what was your driver or motivator for moving your career from one location to another?
So mine was a little different. I started a little younger than Gillian, so I was somewhere else in my career at that time. I was actually probably a year post-grad, just out of nursing school in Ireland. I had 4 or 5 friends who definitely wanted to come to the United States. The interesting thing about my class, Lea, there were 52 of us in our class. And of those 52, I think about 40 went to Australia and 6 of us came to the United States. So at that time, the economy wasn't great in Ireland. We were looking for opportunity in other parts of the world. So my journey was actually the NCLEX pen and paper journey, if anybody remembers back that far. I came to the United States and took the pen and paper version of the NCLEX. It was a great adventure for us. I think it was definitely my first time flying to the United States. So it was a pure adventure for us. We'd go and take the exam. We didn't study too much. We said, well, if we pass, we'll go and work for O'Grady Payton for a year. So I think 5 of 6 of us passed. And then in turn, we were to work for O'Grady Payton International for a year. So my assignment was in Merced, California. I thought I was going to San Francisco, but Merced is not quite the city. So that was definitely a very unique opportunity for all of us, and it was a terrific experience.
Well, and for our audience who may not know, now, of course, in the digital age, there's access to take that NCLEX without
That's
having to
right.
hop on a plane and come to the
Yeah.
U.S. But back then, you had to come. So it was that was probably a barrier for many being able to get here to do that. So that's
The great
amazing.
thing was the Grady Payton paid for the flight, so that was part of the attraction.
Yes, I bet. Yes, definitely. So I would love to know for both of you, what were the greatest obstacles and barriers that you had to really work through, the challenges of going through that process? Again, for people listening to our podcasts that have never migrated, never had to pick up a career and go to another country and go through all of the regulatory barriers that exist and the testing, it would be great to open that story a little bit and share it with people. It's a hard process. It's not something you do overnight. Gillian, you had mentioned that yours happened fairly quickly, but not everyone's happens that way. Some people wait many years because of visa restrictions or whatever. So I'm curious, what were the obstacles you had to overcome, or the greatest challenges, and was there a point when you wanted to give up, or it looked like it wasn't going to happen? So I'll throw that out to either of you, though. You want to take it first?
Um, well, for me, I think there were my biggest obstacles, perhaps, were just not knowing, and I'm a persistent questioner, so I asked a ton of questions, and that really helped. Michelle Kilkenny, who leads our immigration team here, she was fabulous. She answered all of my questions. My husband had questions. I sent them to her. She answered them. So it really was fairly smooth, because I got all my questions answered. I did a ton of research online just to satisfy that, feeling of not knowing what I was, going to face. So yeah, I think that was the biggest thing. Just a lot of research and a lot of questions, and the team here, they were very open with me, gave me real information, so I knew what I was getting into and the steps to take to get here.
That's great. That's great. Sinead,
I think
obstacles or challenges?
I think for me, partnering with a company that was able to facilitate all of the processes and licensure and so on was very helpful. We were coming for fun. We kind of left it to O'Grady Payton to help us get licensed and make sure we had everything that we needed to practice as a nurse. So certainly that helped, I think, in the obstacles. And then I would say my next biggest obstacle was probably in the clinical space, being such a new graduate. I think in hindsight, as I look back, I had so little experience as a nurse that probably made my transition a lot harder.
And that kind of goes into the next question. Actually, was we look at the challenges of getting here, getting your visa, going through visa screening, going through your credentials assessment, all the evaluation, the stuff that we do at CGFNS. You know, picking up and moving a family to another country and finding a new home and a new community to live in. All of those things are difficult. It's a challenging journey. It can be exciting and an adventure, like you said, to move somewhere new, but there's a lot of logistics to work out. But the thing that we don't hear necessarily as much that you just touched on there, that I would love to hear about from both of you, is the acclimation process once you get here, and that's not just the onboarding at your new job or your health system and, stepping into a new country's regulatory requirements and documentation requirements, working with new technology and maybe new, scope of practice or standards of practice, but it's also how you build a new life in a new community and acclimate. So I'd love to hear what that was like, because at CGFNS we're very focused on that front end, but that acclimation and really being able to thrive. What did it take to thrive in your new role in a new country, new community, new job? Gillian?
Well, for me, going into that environment, which I knew from doing a lot of research online, that it was going to be very different, that nursing practice was going to be very different. So when I got there, one, I was resolved to go with an open mind, because I knew it would not be like back home, as we say, right? And I knew there would be a lot for me to learn about And the other piece of uncertainty was I had no idea how I'd be accepted, right? Because here I am, this person with a totally different accent, and I'm brown skinned. I don't know how I would be accepted, right?
Yep.
One of the things that stood out to me one day, a young lady, I think she was a patient care technician, she asked a question, where are you from? It was a very common thing, right? As soon as I opened my mouth. And so I said, I'm from Trinidad in the Caribbean. And she said, wow, how long did it take to drive here from Trinidad? So needless to say, I explained that piece to her. But, when I started on the unit, one thing I was resolved to do is just pour the honey out, right? Yeah. So I would go up to people, introduce myself and just kind of be a little vulnerable. I would let them know, hey, I'm new here. I have a ton of questions, but please have patience with me. And I think that maybe they felt sorry for me, but it helped because, I was being a little vulnerable, letting them know what I needed and that I needed their help. And once I think people know that you need their help and you're open to them, I think they're much more apt to help you. And I would have people coming up to me to say, hey, Gillian, are you okay? Come and see this. I'm doing this new thing. Because there was one nurse I had let know that I didn't have much experience with putting in IVs, for example. And she would say, come, we have an IV here. Come and see how to do it. Yeah. Come and practice. So just putting myself out there early, being a little vulnerable, but showing that openness, that really helped. And that was one way I got a lot of new experiences, got to learn and made friends and, just became closer with the staff. So that willingness to put myself out there, it was a little scary, but it really helped.
Well, and opening yourself up to learning and being mentored. I know you touched on something there were probably people who mentored you through that process, and none of us can do these things alone. So it's important to pull close to people who can, help us on our journey. Sinead, similar story, similar challenges?
I would say probably not as structured as Gillian, because Gillian came about 13 years after me. So part of Gillian's experience was probably because of my not so great experience. Yeah. One of my commitments in my career has always been to make sure the healthcare system understands what an international nurse needs. And I'll tell you why. So I got here, 3 of us were, I think, to be assigned to the same unit. We did not insert IVs back in Ireland. It was within the scope of the junior physicians. So the way that they thought they would teach us was actually to practice on each other. So in this orientation classroom setting, which was one day, we got the opportunity to essentially practice being a puncture on each other. And I had this massive hematoma for probably about 6 weeks because my friend blew my vein. Yeah. But my orientation was actually, they thought I was a travel nurse. I was coming into this facility in California, and their plan was to give me 3 days of orientation. So I was a new nurse, 1 year of post-grad experience, coming into a completely foreign environment. And I mean that both clinically and culturally. And the expectation was I would get 3 days of orientation and I would be able to practice competently. Remember on my 3rd day of orientation, first shift on the floor, I was written up for not changing the TPN line. Well, I barely knew what a TPN line was, never mind about the fact that I had to change it every 3 days.
Right.
So those types of things were very foreign to us, how we record, in a physician's chart, everything that you use. At that time, there were labels on everything that you would use, and you would have to make sure you put all the labels into the patient's chart so that they could be charged appropriately for that item. That's completely foreign to the healthcare systems that we come from. We come from healthcare systems that are socialized, and it's a very different way to approach healthcare. So that was essentially my onboarding experience. I would say the things that got me through it was the fact that we were grouped together. So we were able to have that support when we came off shift. So what happened in your day? How was it different? What did you learn? Those types of things. And I think that that's critical in international nurses' success, is having their people whatever those people look like or feel like, or their friends, their family around them, so that you can process everything that you're learning in that initial couple of weeks, because it's very overwhelming.
Wow, very interesting story. I have to share with you my first job in healthcare, other than volunteering as a teenager, was phlebotomy. And we practiced on each other. Of course, we were taking stuff out, you're putting stuff in, but we would practice on an orange or on each other. So I remember having more than a few bruises back in the day, for sure. So we touched on, and you said a lot of, I remember those labels too. You'd get those long sheets of labels and they had to go on everything in the chart, on all the equipment and everything. So that brought me back a little bit. So we touched on acclimation, and I'm assuming that those experiences, because you mentioned it at the front end of that, Sinead, that now that you're in the position you're in now, it's something you're passionate about, making sure, based on your own experiences, that the health systems, recruiting organizations, health systems, who are going to be employing your clients, understand the transition that needs to be made. But I would also think that you guys, as a recruiting organization, are also familiar with what the needs are going to be. You're equipped to prepare your clients in a way that maybe you didn't necessarily have the benefit of back then. And all of it's been a learning experience. So I appreciate you guys sharing that. And I was going to ask you what the hardest part has been being a nurse in a different country. I think you've touched on that, but I don't know if there's one thing that you would say the most difficult thing for me was.
I would say for me, it was learning the culture and the little pockets of culture that are in so many parts of the United States. Is
Yes.
the patients, the families, the challenges that are in various parts of the United States that you really don't know about until you actually live and work there. And I think our emergency rooms see kind of all of the community as they truly are.
Yeah.
So that was, and again, back to the fact that I was a young nurse, it was life as well that I hadn't been, exposed to maybe so much. So the combination of a different country, a different culture, and then maybe not having enough years of life at that point,
Just maturity in general.
maturity, yeah.
Yeah. Gillian, the hardest thing for you, if you had to put it in
Oh my goodness. The hardest thing, I think, was getting accustomed to the different workload, or the difference in workload, actually. So in Trinidad, I would, a mixture of shifts, but when I did night shifts, we had a 2-hour sleep break. That does not exist here. And in many of our other countries, nurses do get a sleep break at night. But here that does not exist. And sometimes we find nurses being accustomed to that may have times during the night where they may fall asleep because they were accustomed to having that break. And that's something that, we work with them on. But just that workload piece, that was the biggest thing for me to get accustomed to, transitioning from Trinidad to here, especially if you're managing a family. So I came with a very young family.
Right.
So managing the increase in workload, in addition to my young family, that I think was the hardest part. You get accustomed to it, of course, after a while, after the orientation is done, your body becomes accustomed. But I think what was important for me, you really have to take care of yourself as a nurse as well. Yeah. Because when I went to Arizona, of course, it's very dry and you don't drink enough water. And I became ill at one point from being literally dehydrated because I was going from task to task to task and not pausing to even drink water during the day. So I became ill, and that taught me a valuable lesson on taking care of myself. So I always made it a point. I would have like a granola bar or a protein bar in my scrub pocket. I would run to the end of the hall where the water fountain was and have water, eat my bar really quickly, because not all of the time I would get a chance to take my meal break. And that saved me. But, taking care of yourself, drinking water, that really helps me to get through that difficult, workload time.
adjusting to just even climate difference. I
Yes.
live in Florida, so I can tell you
Yes.
every time I'm in Nevada or Arizona, I have to remind myself now, bring your eye drops because I wear contacts and it's super dry there.
Yep.
Drink more water because I'm in a humid environment and you forget about those things. You know, it's really interesting when you touched on the sleep, which I didn't know. That's such an interesting, it's one of so many things. And Sinead, you talked about we didn't start lines where I was, or we'd had a 2 hour nap break at night. It speaks to the disparity of practice and expectation, which I imagine you probably bump into quite a bit when you move into the workflow of a new country, a new environment. I know when I came to CGFNS a year or so ago, and I've been in healthcare for a long time, but I've been here in this role for about a year. It was very eye-opening to me to learn how different the practice, not just standards, but work just down to the workflow. And what scope of practice variability is from one country to the next, which does make standardizing that globally or internationally very difficult. It's very siloed, and it probably sets up different expectations. So I appreciate you sharing. There's probably a million more examples that you could share across your experiences there, but those are a few interesting ones that I'm sure are new to our audience as well. So let's talk about the work that you do today and how your career trajectories moved you into the roles that you're in now. I think it's probably obvious to our audience and to me by now that your own experiences have shaped your passion for helping other people navigate this process successfully and really be able to move their portable skills to other regions of the world and be successful there and really thrive there. But how did you get there? I mean, you didn't come right to the U.S. to move into a recruiting role, I'm assuming. How long did you work in frontline care before you said, I think I have a passion for helping other people do this, Sinead?
So I had a couple of things happening when I decided to maybe move away from the floor. I was looking for a 9 to 5 job, and I had met my future husband. So I was looking for a difference in the shift patterns. I really had worked a lot of nights, and wanted kind of that guarantee of Monday to Friday,
Sure.
9 to 5.
Yep.
So that was really why I came to the recruitment side of the industry. But then as I came into my career with O'Grady Peyton International, I really found what I was passionate about, which was the ability to influence the experience of others coming behind me. And I worked a couple of roles. I worked at the beginning in a clinical role as a nurse, obviously, but then moved into things like placement. So, how to find the right match for a nurse. And then eventually became client facing. And in that role, I think as a nurse, speaking to CNEs and chief nursing officers and having them understand from the voice of the international nurse what is needed for you to be successful as a nurse in the United States. And that's really where I found my passion in the industry was, oh, wow, I have the ability to influence, the experience of other nurses coming behind me. So how do I really leverage that, so that these nurses have really great orientation experiences? Because that solid orientation is it's make or break
Yeah.
for an international nurse. So that's what I found I love to do, and ultimately how I ended up where I am today.
Absolutely. Well, I should tell our audience too, you're part of our Alliance for Ethical Recruitment, which I'll touch on towards the end. And Sinead was one of our first honorees this year of the CGFNS Daisy Award for ethical recruitment. So congratulations again on
Thank
that.
you.
So your passion has taken you to a position where there's acknowledgement by your peers and across the industry for the great work that you're doing. So it's there's a lot of fruit to what you've been sowing there at MNN. So or AMN. All right, Gillian, what about you? Your story? How did you move from frontline care over to recruitment and doing the work that you are today?
So that move, or rather the impetus for that move, actually started while I was on assignment. So when I was around 3 to 4 months in, again the bug bit me, and I started a business bachelor's, a healthcare management bachelor's degree, and it was supposed to be finished around the time my assignment was nearing the end. And it did. I would take my laptop to work with me, and I would stay back after shifts to finish assignments, because I knew if I went home without finishing the assignments with the kids, I may not get the assignments done. So
Right.
I really, put some hard work into it. I told my OGP clinical manager what I was doing. So she was a huge supporter for me. So around the time my assignment was to be done, she reached out to me to check on me, to see how I was doing, if everything was okay, just like we do today. And she said, "Oh, so you're finished with the degree. We have this position open for a clinical manager at the OGP office. Why don't you apply?" And I paused for a second and I thought, oh my goodness, opportunity is knocking. And I was like, why not? So I applied and was hired with O'Grady Payton as soon as my assignment was done into a clinical manager role. And this was in 2007. And really, I stayed in this clinical role all through my career with O'Grady Payton. So started as a clinical manager, then was promoted to clinical director, and now this role where I lead our team as we support both our international clinicians. Prior to coming, as they're on assignment, we do a lot of teaching, guiding them around practice, the culture, getting accustomed, expectations, all of that. And we also educate our leaders, because it's so important, to Sinead's point, that they understand what the nurses need, the differences in practice, what they all need to overcome in order to practice safely and well here. So we educate on both fronts, both the clinicians and our leaders, so that we have this great successful assignments for them. And this is how we support them in their careers as well, right?
Yes,
because
absolutely.
we help them to stay on maybe as core staff at the hospitals, and so it's a win-win for both the nurses and the facilities too.
So you've taken us, I'd love to spend just our last few minutes here talking about the current climate. You're working with internationally positioned, foreign educated nurses around the world, and other health workers, presumably. I don't know if it's just nurses, but what, and Sinead, given the fact that your migration story is a number of years ago, there's probably been significant change. Are you seeing the same drivers and motivators for career mobility? Do they change? What's driving that? And what challenges are you seeing today with the health workforce members that you're working with? Basically kind of discuss that, and we'll move on to a couple of other things. But is the climate as it was when you were migrating? Are there changes? I mean, there are economic factors, political factors change. And there's certainly a lot of drivers that we're seeing globally,
Yeah.
Economic, gender related, sometimes gender opportunities are driving decisions around this as well. So I'm just curious what you're seeing.
Yeah. It definitely has changed over time. I think maybe when I came back in the 90s, there were a lot more single people coming to the United States for the adventure. Um, Over the years, I think what I've seen to be most significant is most international clinicians want to give their family the greatest opportunity in life. And many people believe that, that's here in the United States, it might be in another part of the world. And so many clinicians migrate more than once. So
Yeah.
they think their ultimate journey is the United States, but they migrate maybe to the UK or the Middle East, and then they build full lives in those countries. So sometimes they change their mind along their migration journey. But I think what I've seen to be consistent is probably the biggest driver for most clinicians is the ability to change the trajectory of their families' lives.
Family.
And then certainly economic for many clinicians, but it's hardly ever the primary driver. It's usually a better life for myself and my children, or a better educational opportunity similar to Gillian's path. Gillian's was not economically driven. It was mostly career and educationally
Right.
driven.
Yeah.
So most people assume that it's economically driven, but I would say that I've not seen that to be true. It's definitely family motivated, a greater or better life for your children, and then career mobility.
Yeah.
Um, and I think that the biggest challenge for international nurses today is the speed at which the profession is changing. So we've seen, advanced roles emerge a lot
Yeah.
over the last 5 years. The scope of practice is changing, and then the integration of technology in healthcare
Yeah.
is probably accelerating at a much faster pace here in the United States. So while that initial orientation is critical, it's the speed at which how fast can you embrace the technological
Yeah.
changes that we're experiencing today? Because I think I've seen them faster in the last 4 years, certainly post
Yeah.
COVID, than they have ever been in the past.
Especially when you look at telehealth and remote
Yeah.
monitoring and the evolution of AI in healthcare and the clinical decision tools that we're
Mm.
seeing today as opposed to just a few years ago before COVID. It's hard enough to acclimate that if as a domestically trained nurse, moving into that from an international position is probably even more challenging for sure. I appreciate you touching on that because I think it's important for our audience to know that people don't migrate solely for jobs. I mean, they're again one of the things I've learned over the last year or so, and continues to come up on this podcast, is the reality that career mobility doesn't always mean moving from one place to another. It's also about the mobility upward in terms of advanced education. And not every country, some countries, nurses are limited to level 1 or RN level nursing training, and they have to move, even if it's just temporarily, to another country to pursue bachelor's or master's or even PhD level programs that are not available to them in their countries. And so I think it's important. It's not always about pursuing a job, though those are at the tail end ultimately of what people are doing. So you touched on that note, which is great. Gillian, your thoughts on the current drivers and motivators and challenges of the workforce members that you're working with every day?
I think, similar to Sinead, it's the opportunities that they can derive for themselves, in addition to their families. So many of our clinicians, we hear about, they ask us questions about going back to school. We have families where both the parent or the nurse and the teenage child, they're looking at colleges or universities and programs, and they're asking us for advice. So really that's number one. And similar to my path as well, where several years ago I decided to pursue a master's in nursing education. It's that same kind of driver to, improve your education and, just derive the benefits that come about as a result of that.
Yeah.
So nurses should come with just that kind of growth mindset, right? Not intending to just stay, be static. But there is so much opportunity here. So nurses should come with that. And I say nurses, healthcare professionals in general,
Right.
should come with that kind of growth mindset because there is just so much opportunity.
Yeah. And not just in the US, but increasingly, as you mentioned, Sinead, in other areas of the world, Middle East and in the UK and New Zealand, Australia, some of those common destination locations for work. I appreciate you guys diving in on that. I wanted to close. I didn't actually pitch this question to you beforehand, but we touched on it earlier. And Sinead, I'd love for you to talk just a little bit about the importance of ethical standards for recruitment. There is always concern about how internationally trained nurses and health workers are approached and recruited to move into a new country. Can you talk about that ethical recruitment? I know you guys are passionate about it. You certainly, again, as I mentioned before, part of our ethical alliance and certified through our alliance as an ethical recruiter. And, in your experience, what have you seen that has driven your, commitment to that, to say this has to be done the right way?
Yeah. And it's really back to how long our commitment has been to ethical recruitment, Lea. I mean, I think You probably know, when the alliance was first founded, O'Grady Peyton was the first company to put up
Yeah.
their hand and say, before everything else, ethics is the core of who we are.
Yeah.
Because there are parts of the world where there are extreme disparities in how people are treated and how they can maybe get on a migrant journey to a better part of the world. So that's really been fundamentally at our core is, how do we ethically recruit our healthcare professionals? How do we make sure we're fully transparent in what we're going to do for them and what we expect of them equally? And then how do we help them along the way so that their transition to the United States is as good as it can be with the support and structure that we can wrap around them so that they ultimately are clinically successfully and socially. I mean, we bring the healthcare professionals, but they don't come by themselves.
Yeah.
They come with a spouse, they come with kids. They don't know how to navigate some of the social challenges of coming to the United States. So I think that that's part of being an ethical recruitment company is you have to help them along their journey, whatever that means. And it might be clinical. And, Gillian and I certainly over the years have had situations where, a clinician was going through something that was not within the scope of what we signed up to do in terms of helping them, but maybe some crisis that they were going through where, we had to put our heads together and figure out how we help this clinician who's now in another country by themselves,
Yeah.
or maybe without their extended family. So how you do sign up for more when you're an international recruitment company because our clinicians are leaving their people behind them.
Yeah.
So you essentially become an extension of their family here.
Well, and if you're doing it well and with integrity, you're a steward of their journey, and you're really protecting and watching out, taking care of them. We hear people talk about human trafficking. I would just say for our general audience, it's so easy for people to quickly assume that that's a reference to sex trafficking, when people don't often realize how problematic globally that labor trafficking really is, and the importance of for you guys to really be looking at how not only how people are recruited, but really watching out for and helping them navigate the contract portion of their their employment in a new country, really looking at those contracts, making sure they're asking the right questions, empowered with the right information, so they're not signing their lives away to something that that they can't get out of. The journey is hard enough. So I just want to commend you, and your organization for being the first to raise a hand and step out and say, this is critical to the lives of so many people, and we're going to abide by those code standards.
And certainly social media has helped a lot bridge the gap of the lack of information. The one thing about social media is really trying to get to the accurate details. So while social media is extraordinarily helpful to our clinicians on their journey, it doesn't always give them all of the information that they need. So I think that balance is make sure you have a transparent, ethical partner who is assisting you with your journey, and then leverage the power of social media to get information that maybe you don't already have. And that certainly helps you figure out what are the steps in the process.
Well, and it helps that you've built your business with people who've been through this experience themselves. You don't want to see people taken advantage of. You've been on this journey, and it's probably comforting to them to know they're working with people who've been in a relatable position. Well, I want to thank you both for joining us today. This has been a great conversation. So inspired by your stories and by the work that you do. Love that you're a friend to CGFNS, and that we have. I think, Sinead, we're going to see each other tomorrow at the Alliance meeting in Philadelphia. So I'm looking forward to seeing you in person. Gillian, thank you so much for joining in and sharing your work as well. For everyone that's joining, you can find Gillian and Sinead both on LinkedIn if you want to reach out to them or connect with them and follow their journeys beyond this podcast. Thank you for joining us, and we'll see you next time. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at cgfns.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.